Sickle cell disease is a rare anemia disorder that is characterized by hemolytic anemia and recurrent vaso-occlusive events. This is leading to acute and chronic severe pain crisis and progressive multi-organ damage. Overall, patients with sickle cell disease have decreased life expectancy and poor quality of life. The gold standard curative treatment is HLA-identical sibling hematopoietic stem cell transplantation. However, it is only available in around 20% of the patients and normally is indicated before we know the severity of the patient later in life. More recently, the EMA has approved gene therapy in sickle cell disease and new drugs. Then the question is how we can know what is the best treatment for each patient based on their individual characteristics. Unfortunately, as in other rare diseases, the lack and fragmentation of clinical data prevent researchers from identifying biomarkers for disease prognosis and response to treatment. In this sense, the RADIP registry, endorsed by the ERN-EuroBloodNet, was created with the objective of collect sufficient data of high quality to enable data-driven research. This is what we are doing in the frame of two EU-funded projects, GenoMed for All and Syntema, in which we link the standardized clinical data from 1,000 sickle cell disease patients with research data in order to develop AI models for risk score of major clinical complications and to generate synthetic data in sickle cell disease. The next challenge will be to include also a data set from patient self-reported information. This part will start next year in several countries, including Spain, where we collaborate with ASAFE, that is the Spanish Association of Patients with Sickle Cell Disease. What we expect is that with these results, will impact in the clinical management of up to 50,000 sickle cell disease patients that live in Europe according to the RADIP epidemiological data.